I'm going to pull us back to the next two speakers. If the conversations around the table are as lively as what was just happening in the women's washroom, it's certainly lots of interesting discussion going on. So it's my pleasure now to introduce Jacqueline Choiniere, an assistant professor at the School of Nursing at York University and a registered nurse, who is also the Director of Policy and Research for the Registered Nurses Association of Ontario. Jackie's research has focused on accountability in healthcare policy and practices, and nurses' practices in the context of health reform. Jacquie.
Hello. Good morning. The title of my talk is that Context Matters, Nurses' Mental Health Risks, and this is a report of ongoing research. This is a report of research that a group of people in this room even are involved in. And once again, it's a SSHRC-funded 3-year project that Pat Armstrong is a principal investigator, and now you're probably beginning to understand why it takes a volcano to ground her. She's a very busy woman, and co-investigators Tamara Daly, Hugh Armstrong, Judith McDonnell, Meredith Lilly, Walter Giesbrecht, Paul Tulloch, and myself. And it is a 3-year SSHRC-funded study again, and it is in progress. So what I'm going to talk about today are some preliminary results. So it's important also to talk about what prompted or what motivated us to look at these particular issues. And indeed, as we all know, over the past while, there's been a high profile given to the violence that nurses encounter in their workplace. We've had a number of studies looking at it. The National Survey of the Work and Health of Nurses was one study that particularly motivated us to look more deeply into this, because we found that study, as valuable as it was and as important as it was to indicate the extent of violence and risk that nurses face, it really didn't delve into the conditions and the particular features and relations. So specifically, it ignores the gendered and racialized dynamics of that violence, and we thought it was really, really important to look more closely at that. And the other issue motivating us was the reality of a gap in mainstream nursing literature looking at these particular issues. So the study is two-pronged. There's a quantitative aspect that is going to do a finer-tuned analysis of the findings from the larger study, the National Study of the Work and Health of Nurses. And there's a qualitative aspect, which is the one I'm going to talk about today. And once again, we were interested particularly in delving into those social dynamics, so to come with a better idea about what the particular risks and violence that nurses were encountering and what they look like. And again, we're looking at RNs and RPNs across various healthcare settings in Ontario. And our ultimate goal is to identify supportive policies. Okay, so our context, our lens is important, how we approach this study. With a feminist political economy lens, which means that we recognized the prominence of current market-based reforms, just the way in which reforms are playing out in all healthcare sectors. And once again, it reflects on the gendered and racialized connections between work and home, that was particularly important to get at if we wanted to look at the full extent and the full complexity of the risks that nurses face. And that nurses have a very valuable perspective where they are located at the interface of care and living through that interface of policies and practice was a particularly critical viewpoint that we needed to capture. So the study the qualitative part of the study revolves around focus groups and individual interviews of registered nurses and registered practical nurses, looking at their stories, their context, how things have changed, how they conceptualize risk, what they consider to be risks, how they consider these risks have changed, and what are the actual experiences of violence and abuse that they are encountering. Okay, so what we found was there has indeed been a dramatic increase in the level of abuse that nurses are facing. And these risks, again, do vary according to context. Risks vary from setting to setting. So, for example, nurses would tell us about the acute care setting and talked about risks occurring where particularly problematic issues of abuse, verbal and physical abuse, in those settings in acute care in which, as one nurse says, quote, patients are warehouse. So alternative levels of care settings, long-term medical settings, medical care settings. But we also encountered a lot of discussions about risks and abuse in mental health care settings. And again, this really does pick up and reflect some of the themes that we've heard already around the normalization of violence in mental health and even in long-term care was very much part of the research that we've been collecting. As one nurse says, violence has become almost a norm, and in part reflecting the change in patients in these two settings. For example, the increase in dementia, the increase in particularly violent encounters within the mental health care settings were things that the nurses underlined and emphasized to us. But I'm going to get back to this normalization of these encounters shortly. Risks also vary among nurses. Racialized nurses report experiences of racism from patients, families, and other providers, and that these experiences were indeed on the increase. For example, the examples that they offered, patients and family members who questioned or undermined a nurse's care because of race. Nurses experiencing bullying or horizontal violence from colleagues. And also reflected in things, reports about who asks whom, some of these, back to the horizontal violence and the bullying. The encounters between nurses about who asks whom for help and who will respond to requests for help. So the nature of the reported risks also reflect assumptions about power, and very much a gendered and class-informed power. There were lots of discussions about physician-on-nurse abuse. Examples from physicians throwing surgical instruments if the nurse that he or she, that, in this case it was he, was working with wasn't responding quickly enough. So, as one nurse said, he yells, now, 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 and if you hand him something and it's not what he wants, it's going across the room, verbally abusing the person who's assisting him. Nurses also report family members who refuse to engage with them, and this again because they've interpreted because of their gender, and there was a lack of valuing of their advice when it came to care. Also, the risks reflect the intensity of work, the dramatic increase in overtime and the fatigue and the intensity in all the work settings was a very frequent finding and report from these nurses. As a lot of nurses says, but this one in particular, it used to be so different. We used to enjoy coming to work, but there isn't any time for that level of engagement that we used to experience in the current work setting. And the stress and the risks are definitely described as being taken home to their families. My family knows that you don't talk to me for at least an hour after I get home, was one quote. Another nurse mentioned, I have fights with my children over things I really shouldn't. And another, when I was working nights, my family avoid me at all costs, and my husband tells me I come home ready to blow. And reflecting on the constancy of the stress, you get sucked up as a person. You aren't a person anymore. You become a piece to everyone. Everything has changed. Everything around me has changed. It affects my friends and my total life.